PRP or hair transplant. The cost of PRP protocol is almost as much as a transplant. What should I do? Can't afford both.
Thank you for your question. You submitted your question with the photo of the top of your head, which shows a fairly significant amount of thinning in the crown and mid-scalp area. And you're asking a question where you have recognized that a PRP protocol is comparable to the cost of a hair transplant. So you're asking which should you do since you cannot afford both. Well, I can certainly share with you how I counsel my patients who I discuss this exact situation with every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed which evolved from hair transplant surgery as a non-surgical solution for hair loss for both men and women using platelet-rich plasma and acellular matrix. So I can certainly appreciate your concern and question, but I think the one thing that I tell every patient who I counsel about hair loss management is that hair loss cannot be permanently solved, since hair loss is still progressive. The reality is that all treatment options for hair loss, whether it's a pharmaceutical such as minoxidil and finasteride, or a regenerative solution such as PRP acellular matrix, or hair transplant, a surgical option, is a way to help maximize coverage depending on the clinical scenario. But hair loss is still progressive, which means that in a situation like yours, I would most likely share with you the option based on an algorithm that I developed in our practice. Going further about this hair regeneration system we developed, going back to about 2011 or so, we were using acellular matrix and platelet-rich plasma to help people with hair transplants heal better. Essentially, we wanted the donor area to heal better, as well as the grafts to survive better. These are two areas that are of the greatest challenge when it comes to hair transplant surgery. Well, a certain percentage of patients appear to have thickening of thinning hair. It became my mission after that, and a very challenging mission over the many years of development, to figure out a way to dose and deliver in the most optimal way this treatment to help thicken thinning hair. And what was the reason that inspired this? Well, patients like yourself who have large areas in the crown where there was extensive hair loss, but still a significant amount of hair which had been thinning or miniaturized. If I looked at the same patient and saw the results with a transplant versus doing our treatment, I found that the injection actually worked better. What was the reason behind that? Well, it became clear that as long as there was a significant number of existing hairs, the density and the amount of coverage actually with this injection treatment would exceed not just one, but 2 transplants. Now, certainly I get a lot of challenges on this question, on this statement, but it's simply a question of numbers. The number of hairs that you can transplant at a given time is typically between 1,500 to 2,500 grafts. When you think about that in terms of the number of hairs that can be covered per square centimeter, it becomes clear that the large area of the crown cannot be that well covered even if you were to go even higher, getting into more of a mega session scenario. Plus, a significant percentage of existing hairs get lost with collateral damage from the trauma of surgery. Putting that aside, you have to also realize that once you've reached this type of threshold where there's a significant amount of scalp showing, once you have one transplant, you are essentially committed to needing a second transplant because the numbers of hairs available to cover the scalp is diminishing in a more significant proportion compared to where you were 10 years ago. It's just that the reserve is becoming depleted. So when you come to a situation where you're making a financial decision, I would advise you to strongly consider what your budget is for management. In a scenario like yours, and again, what we developed over the past 7-8 years has also become a classification system based on the wide range of patients that we've treated. Everybody from young males with aggressive loss to middle-aged to older males with moderate to advanced hair loss to female pattern hair loss in a wide range of patients. What my point is that there was clearly a need for customization. Further, certain groups of men are more DHT sensitive than others, and so it also required an incorporation or consideration of a DHT blocker. So in your situation, it might be also worth for you to consider adding a DHT blocker like finasteride. Again, hair loss is managed, and if you are committed to managing your hair loss, well, it's not a one-off process. It is management, whether you choose surgery or any other approach. You have to understand hair loss is still progressive. So it is important for you to have this discussion with whoever you choose to help you with your hair loss management. If you feel like you only have so much money to spend, I think you're going to find yourself frustrated because you're not going to be able to continue maintaining your coverage for as long as you would like. And I think this is very, very important, and it is something that is frequently overlooked in a world where cosmetic procedures are more transactional than about long-term management. As a cosmetic surgeon practicing over 20 years, I have so many patients who I take care of for their aesthetic needs for so long, and not just their cosmetic surgical procedures. It became something that we did naturally with hair regeneration, and we followed our patient for years and years and years, and we've learned a lot about the behavior and progression of hair loss and the relative responsiveness to the different modalities that we've used. So think about what I've described to you in terms of your long-term plan. Think of not just what's going to happen in the next couple of years, but what's going to happen over the next 5 to 10 years. And think about how you can budget accordingly and meet with a doctor who can work with you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.